So, we are going to be talking all about poisons, what they are, what they can do, and most importantly, what to do in case someone close to you gets poisoned. Today's topic, hydrocarbons. Now, hydrocarbons are simple organic compounds that contain only carbon and hydrogen. So these hydrocarbons can be categorized into different types. So the categories are aliphatic hydrocarbons, such as kerosene, gasoline, and lighter fluids. We also have aromatic hydrocarbons, which contains one or more hydrocarbon ring. And we have halogenated hydrocarbons, which contain the halogens, like chloroform. So, hydrocarbon poisoning is potentially fatal. And as such, they are also common household substances, so that both medical and non-medical personnel must know the signs and symptoms of hydrocarbon poisoning. So, what are the most common causes of hydrocarbon poisoning? First is accidental ingestion, especially since hydrocarbons such as gasoline and fuel are stored in beverage bottles and cans. And the remaining are due to substance abuse and due to suicide attempts.
For the mechanism of toxicity, hydrocarbons cause toxicity by directly damaging the tissues. This may lead to tissue necrosis and burns and inflammation at the site of exposure. Pulmonary aspiration is due to direct tissue damage and disruption of the surfactants found in the lungs. This is the primary life-threatening condition that may result from hydrocarbon ingestion. Other symptoms include CNS symptoms such as lethargy and depressed senses, cardiovascular arrhythmias, renal and hepatic toxicity, GI distress, local irritation, inflammation, and swelling. Ingestion of amounts as little as 10 to 20 ml can cause fatal systemic effects. Now, what do we do in case of poisoning? First, we have discerned certain signs and symptoms to make sure that hydrocarbon are the cause of toxicity. We can check the breath or odor of the clothes if it smells like gasoline. Check respiration if there exists tachypnea, rales, and wheezing, which indicates pulmonary aspiration. Check for abnormalities in pulse rate, and check the skin for signs of burns or lesions due to contact with the substance. The appropriate steps are: move the person away from the area of contamination, especially if the poison was inhaled. Administer oxygen ASAP. If the skin was exposed to the poison, remove contaminated clothing and wash affected area with soap and water. Bring the patient to the hospital where he or she can receive the appropriate medical treatment.
The different laboratory tests that we can use are arterial blood gas, complete blood count, electrolytes, BUN, and creatinine, liver function test, urinalysis, and creatinine clearance. So next we go to the general treatment for hydrocarbon poisoning. So the treatment for hydrocarbon poisoning is supportive only. So you ensure the patient's VCO, ventilation, circulation, and oxygenation. If the patient suffers from pulmonary aspiration, you treat the bronchospasm and hypoxia. Remember not to give steroids and antibiotics. That's it for today's show. Thank you for watching.
Ba 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 banana. Ba 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 banana. Oh ba 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 banana. Ba 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 banana. Ba ba banana. Togari no potato rica ni malo manica no chica. Ba 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 banana. Yo plano fu la mano no tu. Ma banana la camo petala mo banana. Ba 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 banana. Potato. Tocali no potato, li cani, malo manica, no ti capa.